But before I do that, I want to take a step back and talk about vision and general health as a whole, including Parkinson's. And I do this for two reasons. One is that I think understanding the role that vision plays in our health is important for kind of putting its effects on Parkinson's in context. And also, I always tell my patients, because you have Parkinson's doesn't mean that you stop being regular person too. And a lot of the things that we talk about with regards to vision are broadly applicable to everyone, including people with Parkinson's. So I would argue that vision is our most dominant sense. It's the sense that we interact with the world the most, and critical for navigating our world, for driving or even walking, for making eye contact with people and communicating with people. So we rely very heavily on vision, and in fact, 40% of our brains are devoted to vision alone, so in some way. So our brains are wired to spend a lot of effort on vision. As I said, it's integral to many daily activities like reading, writing, and driving. And I think this is increasingly becoming important to recognize as technology plays a greater and greater role in our lives. You all are using your computer, tablets, or phones to be on Zoom right now, and maybe starting to use texting and email more than you might have talked on the phone before. So as we continue to move in this direction, I think it's ever more important to understand that vision is involved in these things. What we also know is that visual impairment of any cause is associated with poor health outcomes in the general population, and as well as Parkinson's. This includes like the risk of falls and injuries, such as hip fracture, the risk of depression or anxiety, and even things like cognitive impairment and dementia. So in other words, vision is very important for our general health in many ways. And also important to recognize is that at least half of all visual impairment in the United States is caused by eye diseases that are treatable or preventable. Things like refractive error, which just means needing glasses, cataracts, glaucoma, macular degeneration. And these are all things that increase with age as well, as does Parkinson's. So as a result, there are many common age-related eye diseases that affect people with Parkinson's. And this is why I think it's important for everyone to see an eye doctor regularly, regardless of whether you have PD or not. But moving into vision and Parkinson's a little bit more specifically, I think there's some general principles to keep in mind as we talk about specific symptoms. One is that, I do think vision is affected in PD, and this is something that people have probably suspected for a long time, but is becoming more and more recognized, in recent years. But like Parkinson's and all its other symptoms, which are variable from one individual to the next and can affect some people more than others, the effect of Parkinson's on vision can occur in a number of different ways, and the experience is different for everyone. So of the symptoms that we'll talk about, you may have some, you may not have others, you may have all of them, or you may have none of them, and that experience is different for everyone. An important thing to recognize is that while vision may not be the greatest source of difficulty or disability, it can negatively impact quality of life. But importantly, the type of visual symptoms that we're talking about are not ones that result in loss of vision. Or in other words, Parkinson's will not cause anyone to go blind. We're talking about visual symptoms that affect your vision in other ways besides visual acuity as might be used to thinking about it. The good news is that many of these symptoms are treatable, but those treatments are usually not consisting of adjusting Parkinson's medications, but rather about non-medication-based interventions, such as adjusting your glasses, using eye drops, or other lifestyle modifications. That's a little bit different than motor symptoms of Parkinson's, for example. And then if you do develop a new problem with vision, a question that frequently comes up is, is this my Parkinson's or is it some other eye problem like cataracts? And it's very difficult to tell that just based on some symptoms alone. So I could spend a lot of time trying to tell you, how to recognize something as Parkinson's related versus not, but that's actually very, very difficult to do. And in particular, the visual symptoms that we talk about as being Parkinson's related are often difficult to describe. So you might say things like, I'm having difficulty seeing, or I'm just not seeing well. And it's very hard for you, let alone for us, as your doctors, to tell based on just that alone whether your symptoms are Parkinson's related or not. And this is something that really requires an exam and seeing a doctor to help distinguish between. So it's important for your doctor to, for you to see your doctor, and then for them to be able to kind of tease out whether the troubles that you're having are Parkinson's related or are due to some other problem with vision besides Parkinson's, as those might be treated differently. So I'm going to go through 5 kind of common visual symptoms in Parkinson's disease, and then we'll have plenty of time for questions at the end. The ones we'll go through are dry eye, double vision, difficulty reading, impaired depth perception, and visual hallucinations. So to start with dry eye is probably the most common visual symptom in Parkinson's. And I always begin this with a very silly question, which is, why do we blink? And the answer is that we blink in order to keep the surface of the eye moist. Basically, when you blink, which people without Parkinson's do about 15 to 20 times a minute, your tears are distributed over the front of the eye, and that's to keep the surface of the eye moist. And in Parkinson's, people do not blink as frequently as people without Parkinson's, and therefore are prone to dry eye. There are also some Parkinson's medications that can worsen dry eye, such as amantadine. And then along across that's called blepharitis. That refers to kind of irritation of the kind of skin of the eyelid, but it often goes hand in hand with dry eye. And I think what's really important to recognize is that dry eye causes more than just dryness. In other words, some people with dry eye can have the feeling of dryness. It feels like the eyes are dry, there's grit in there, it's just uncomfortable. But what's really important to recognize is that dry eye is not just a physical sensation, but it can affect your vision too. So blurring of vision, glare, or kind of sensitivity to light can be due to dry eye. Like I said, the feeling of dryness or irritation, and at times that can be quite painful. People will describe their eyes as sore, aching, or stinging. Dry eye sounds very kind of benign and innocuous, but it really can be quite bothersome and uncomfortable. People can also have a feeling of itching or redness of the eyes, and then sometimes it feels like there's a foreign body in their eyes, like there's sand or some other thing that's in your eyes. And then paradoxically, people can also have eye watering and tearing as a result of dry eye. And that's really important to recognize, because a lot of people think that if their eyes water, then they cannot be dry. How can they be dry if they're watering? But what happens is that when people's eyes are dry, their body reacts by producing extra tears, and that results in the eyes watering. But the problem is that in the setting of dry eye, the tears that are produced are not the right kind, and they don't actually end up lubricating the eye, even though they're supposed to. That is kind of how you can have dry eye, yet have watering eyes at the same time, which I'm emphasizing because it's very counterintuitive, and a lot of patients are kind of confused when they first hear that. But yes, you can have dry eye even if your eyes are watering. And then you can have some of these symptoms or all of them. It's, like I was saying earlier, the experience is different for everyone. And can even be asymptomatic. Many of my Parkinson's patients tell me that they went to the eye doctor and the eye doctor told them they had dry eye, but they didn't really think so, or they didn't really feel it or something like that. And both you and your eye doctor are right in that scenario. You can have dry eye, but you may not have any symptoms of it. In addition to the discomfort and difficulty with vision that dry eye can cause, when it's severe, untreated dry eye can actually lead to some permanent damage too. It can cause scarring of the outer layer of the eye, which is called the cornea, and that can lead to difficulty with vision that is permanent. So all of this to say that dry eye is important. It's not as kind of silly and benign as it sounds, and that it's something to kind of take seriously when you hear it. Dry eye is treated primarily with artificial tears or eye drops. You might ask if the cause of decreased blinking, then maybe the solution is to blink more often. And I certainly welcome anyone who wants to do that to go for it. But I find that blinking is something that's very difficult to be conscious of because it's something that we do automatically, and we have other more important things to do with our time. So you can try to throw in an extra blink every now and then, but I just think that might be just asking a little bit too much, and it's kind of difficult to, it's like reminding people to breathe or something, right? It's not something we think about. One thing I will say is that the blink rate increases naturally with stimulation and activity. So when you are engaged, when you are playing cards or doing a puzzle or exercising or having a stimulating conversation with people, you're more likely to blink than if you were just sitting still, and especially if you were looking at a screen or reading, because those are activities in which we blink less. And that's on purpose, right? We don't want to blink and miss things when we're reading or watching TV. But just keep in mind that those activities can kind of strain or prolong your dry eye. And so might consider things that are a bit more kind of stimulating and activating, like exercise and things like that. But like I was saying earlier, the main treatment for dry eye is artificial tears. These are eye drops that are available over the counter. And it's important to make sure that they are preservative-free artificial tears. And the bottle will always say preservative-free if they are. And specifically, you should avoid any eye drop that says that it's going to remove redness relief, get the red out, anything like that. The reason is that those drops, while they do indeed get the red out, they do so in a way that's not good for your eyes in the long term. It contains a preservative that in the long term can irritate your eyes and make the dryness worse. If you do go to buy artificial tears at the pharmacy, you'll notice both daytime and nighttime preparations, or there'll be like a regular one and then they'll say like something PM. The nighttime one is a little bit thicker, and that is because our eyes tend to dry the most at night when you're not blinking as much. So you can use the day ones during the day and then the nighttime ones at bedtime. The main thing to know is to not use the nighttime one during the day because it will blur your vision a little bit because it's thicker. And you can use artificial tears up to 4 to 6 times a day. There's actually no such thing as too much in the way of artificial tears. This is something that's easy to forget just because of the number of times you have to take it. But one thing I tell patients is to consider timing the eye drops with their carbidopa-levodopa or other medications. That's a medication that many people with Parkinson's take 3 to 4 times a day. So if you line it up with the eye drops, then you're less likely to miss or to forget either of them. I listed a few examples of some over-the-counter preservative-free artificial tears. I don't endorse any one in particular or have any preference for one over the other, and generic is totally fine. But many people ask, what is a brand I should look for? And those are just a few brands you might see. But again, I don't have a preference for one. I'm not getting paid by any of them or anything like that. And then I mentioned earlier that with dry eye, there is this related phenomenon called blepharitis, which is irritation of the eyelids. And that is something that is treated with warm compresses. And what warm compresses do is they kind of loosen kind of clear the oil glands of the skin of the eyelids to help reduce that irritation and inflammation. And so the way warm compresses work are you take a clean kind of paper towel or washcloth, soak it in under some warm water, wring the excess water out, and then place the cloth over your eyelids, your closed eyelids, for about 5 or 10 minutes. And then you can remove it and just gently wipe your eyelids. And that will do that about twice a day, and that will help to reduce some of that inflammation. And then if these don't work, then this is something you should follow up with your eye doctor for. There are some prescription eye drops for kind of dry eye that does not respond to the initial treatments. And there are even some in-office procedures which can help to reduce dry eye. So there's a lot to dry eye in terms of the symptoms, and then a lot in terms of treatment that can be done. All right, so that's dry eye. Next, I'll move on to double vision. And as I've shown with these pictures here, what double vision means is seeing 2 of the same thing instead of just 1. And double vision in general can occur for one of 2 different reasons. One is that if there's a problem in the front of the eye, such as needing eyeglasses or dry eye or cataract, and this causes a type of double vision that persists even when covering the other eye. So let's say that I have double vision, I cover my right eye, and I'm still having double vision with just the left eye. That is a type of double vision that is actually unrelated to Parkinson's and just has to do with something in the front of the eye, like dry eye or needing glasses or something like that. But the type of double vision that I want to emphasize is the type in which each eye is individually healthy, but that the eyes are pointed in a slightly different direction. In other words, that they're misaligned. And what this will cause is double vision that resolves when you cover either eye. So let's say that I have double vision. I cover my right eye, the double vision goes away. I cover the left eye, the double vision also goes away, but only with both eyes open is there double vision. And that is the type of double vision that's potentially related to Parkinson's. This is something that's pretty common. It affects up to 20% of people with Parkinson's. And the most common pattern that we see is to have double vision at near, like when you're reading, but not double vision when you're looking at something far away. And this is something called convergence insufficiency. That just means that the eyes don't come together when you look at something up close. Double vision at up close, but not. Double vision can also...
You're having problems with the sound.
I think double vision can also emerge or worsen sometimes after deep brain stimulation. So if that's the case, then sometimes adjusting the stimulation settings can help. But if not, then as we'll discuss, double vision can be effectively managed in other ways. The main way that we treat double vision is with eyeglasses with prisms. Prisms are a type of eyeglass that works just like regular glasses. They look just like regular glasses. But in addition to correcting for your nearsightedness or farsightedness, they also correct for double vision. You can also wear an eye patch as needed. So like I was saying, the double vision we're talking about is the kind that goes away if you cover either eye. So if you're wearing an eye patch, then that goes away too. A question that I frequently get is, what about eye muscle exercises? And unfortunately, eye muscle exercises tend not to work very well for double vision in general, let alone in Parkinson's. And this has to do with the fact that the eye muscles are fundamentally different from other muscles in the body. They're kind of at molecular level differently. And we actually use our eye muscles constantly. Like right now, as you're looking at the screen, you're using all of your eye muscles, and I'm using all of mine too. So as a result, it's not really a way to exercise them or strengthen them anymore. So the main way that we're treating double vision is with prisms or covering or closing one eye as needed. Next, I'll talk about difficulty reading. And I think this is kind of a symptom that can be due to a variety of underlying causes. I mean, that's because reading is a very complex and demanding task, and it requires several things to be the case. It requires clear vision, especially for when you're looking up close. So anything that affects your vision and how clearly you're seeing will affect reading. Reading also requires your eyes to move quickly from one word to the next. That's not something you realize when you read, but actually every time you move from one word to the next, your eyes are moving just a little bit. And it's important for your eyes to be able to move quickly and accurately to the next word in order for you to read fluidly. And therefore, anything that affects vision, including dry eye or double vision like we just talked about, will disproportionately affect reading compared to other activities like watching TV or looking at someone across the street or something like that. Also important to recognize, here's an example of kind of something unrelated to Parkinson's, but kind of having a big effect, is that everyone, regardless of PD, does start to need reading glasses after about age 40 or 50. One thing to keep in mind is that for people who need correction for both distance and near vision, sometimes their eye doctor will offer them bifocals or progressive lenses. And so here's a schematic of what bifocals look like. There's the lens here. Most of it is the top part that is the prescription for distance, but there's this other part in the bottom that's kind of the prescription for reading. And that does work for plenty of people, but it's important to recognize that with bifocals and progressives, the amount of space in the lens through which you can look to read is pretty limited. And we know that people with Parkinson's can have difficulty moving their eyes quickly and accurately from one word to another when they're limited to the small space for reading. And I say this just to remind people that an option that for many people works better is, instead of having bifocals or progressives, to have separate glasses for distance and near. And for many people with Parkinson's who have difficulty reading, this alone will make things better and will get rid of it. So usually when I see someone with Parkinson's who has difficulty reading, this is the first thing that I suggest to them is instead of bifocals or progressives, to use distance and near glasses separately. Next, let's talk about depth perception. And just to clarify, when I say depth perception, what I mean is the ability to perceive the world in 3 dimensions. Kind of basically what happens is that we have 2 eyes. Each eye sees a 2-dimensional image from a slightly different angle. And then there are parts of our brain that kind of put those together and to kind of construct the kind of 3-dimensional image of the world around us. Kind of a complicated diagram, but basically it's just showing that each eye sees this cube from a slightly different side, and then kind of putting them together is when you really get to see all sides of it. And depth perception in Parkinson's can be affected for a few different reasons. One is that depth perception requires good vision in each eye. So anything that's affecting vision in one eye or the other, by definition, will reduce depth perception. For good depth perception, you also need your eyes to be pointed at the same target. In other words, to not have double vision. So if you're having double vision from Parkinson's, then that will also affect depth perception. And then finally, the parts of the brain that are responsible for combining those 2 images together into one need to be working. And this is actually where most of the difficulty with depth perception comes from, is in the parts of the brain that deal with creating that 3-dimensional image. Some examples of how you might notice difficulty with depth perception. So one is driving or parking. Some people might say that they have difficulty telling how far away their car is from the car next to them, or kind of being nervous about how close they are to the other car. I had a patient once tell me that she would always park at the back of the parking lot away from all the other cars so that she would know that she was far away from them. Some people might also notice that when they reach for something on a table, they might reach a little bit short, or like if they put a cup on the table, it always tends to be kind of on the edge of the table instead of more safely further back. So those are a few things that can indicate difficulty with depth perception, and then, like I said, a variety of reasons why that might be the case in people with Parkinson's. Here are some examples that I was talking about of kind of leaving a glass on the edge of the table, parking, things like that. Interestingly, some of you may be familiar with the symptom known as freezing, which is when your feet tend to get stuck or kind of taking these small steps. And we know that freezing tends to occur in narrow spaces, such as hallways or doorways. And there is some thought that the depth perception parts of the brain kind of interact with the walking and plant and kind of movement parts of the brain. And that's kind of why freezing happens more in those tight spaces. Just a note on driving, because I mentioned that depth perception is something that comes up when driving. Driving itself is a complex task that involves a number of different modalities, only one of which is vision. And it's important to recognize that driving is not just about seeing the car in front of you in the traffic light, but also paying attention to them, coordination, reaction time, and all of those things. And so Parkinson's-related visual symptoms, perception, can affect driving, but this is usually something that can be managed with caution, just by kind of being careful, going a little bit more slowly, being mindful of the car next to you. Many Parkinson's patients, unfortunately, do have to stop driving at some point in their lives, but this is usually not because of their visual symptoms per se, but rather some of those.
The American Academy of Pediatrics is recommending that returning to school where.
And then the last symptom that I wanted to talk about are visual hallucinations. And you might not think of hallucinations as a visual symptom necessarily, but I do, because they are just very simply defined as seeing something that is not there. So it involves seeing and it involves your vision. So that's why I'm talking about it here. Visual symptoms are quite common in Parkinson's. About half of patients will have them at some point in their life. But hallucinations are frequently underreported, which is why I'm taking the time to talk about them a little bit here. Many people with Parkinson's are afraid that if they say that they're seeing things that are not there, then they'll be perceived as being crazy or as having dementia. And neither of those is the case for people with Parkinson's who have hallucinations. These are a direct manifestation of Parkinson's itself, just like tremor and freezing and softness of speech and the visual symptoms I talked about. And they can appear or worsen with certain medications, so it's important to know about that. Visual hallucinations can come in a variety of different flavors. So initially, people might report kind of a vague illusion of something kind of present or moving off to the side of your vision. So when I say, it just feels like someone's standing next to me, but then I look and I see that no one's there. Or kind of the feeling that just something passes by or moves in the corner of my eye, but it's not there. And then as things progress, they might experience more of what looks like a shadow or passing shape. And then they can see kind of more clearly formed images of animals or children. And then when they're severe, they can be very distressing and threatening. People might feel like or see that someone's trying to break into their house or something like that. So there's a variety of different ways that hallucinations can present in Parkinson's. The treatment for these consists of kind of adjusting your Parkinson's medications, and there are a few medications that can be used specifically to treat hallucinations in Parkinson's if they're needed. One thing I want to kind of touch on is the relationship between vision and hallucinations. Or in other words, is poor vision a risk factor for hallucinations? And the reason I say this is that we know that there is a balance in our brains between visual information that comes from the outside world and information that's stored in our brains. So we see images of the world around us, but we also have images in our minds from previous memories or dreams, things like that. And fundamentally, hallucinations, all they are, is an imbalance between these two images. So it could be that there's too much kind of internal stimulation and unwanted images from memories and dreams, or it could be that sometimes maybe not enough information from the outside world is getting in. And we know that having good vision, in other words, clear images of the outside world, is important for suppressing and preventing hallucinations. In fact, there are some people who have vision loss from eye diseases like macular degeneration, and they can actually have hallucinations that are just like the ones that have happened to people with Parkinson's, even though they don't have Parkinson's. So this is why it's important to see the eye doctor regularly and to make sure that you don't have one of these predisposing eye conditions, and that if you do, that it's identified and treated early. Lastly, I just want to touch briefly on contrast and color vision, because if you read anything about vision in Parkinson's, or if you Google vision Parkinson's disease, you'll probably come across something like this. Contrast acuity or contrast sensitivity refers to the ability to see things under different degrees of brightness. So here's a chart where the top letters are very bold and dark, but as you go down the chart, they become lighter and lighter. And then color vision we test using pictures like this, where there's a number in one color written on a background of a different color. And the bottom line is that these are things that in some studies have been shown to be reduced in people with Parkinson's compared to people without Parkinson's. But they are largely asymptomatic. And I've actually never had a patient complain of either of these to me. So thing that you'll probably read about, but not something that I think will affect you all that much. Just a few questions that I frequently get from people with Parkinson's. One is that, when I take my glasses off, I can't see well, but then when I put my glasses on, I see fine. Is this related to Parkinson's, or is this a sign of any other problem? And the answer to both of those is no, that needing glasses is related to just changes in the shape of the front of the eye, kind of a normal phenomenon that increases with age. But if your vision can be corrected with glasses, then it's fundamentally not anything of concern, either Parkinson's or otherwise. Another question I get is that someone's eye doctor told them that they have cataracts, glaucoma, macular degeneration, or something like that. Is that condition related to Parkinson's? And the answer to that question is probably not. Like I was saying earlier, these are conditions that all are associated with age. And because Parkinson's is also something that's common with age, they're relatively common, or they kind of cluster together. And so many people with Parkinson's have cataracts or glaucoma, but that's not necessarily because of Parkinson's. That's just something that happens over time. Glaucoma and macular degeneration in particular are neurodegenerative conditions. They kind of cause degeneration of the nerves in the back of the eye. And Parkinson's, as you may know, is a neurodegenerative condition of the brain. So there has been the suggestion that maybe, because these are both degenerative conditions, that maybe they share some underlying risk factors, but this is not something that's been shown yet for sure. So for now, we think of Parkinson's and age-related eye disease as more or less independent. Keep in mind that cataracts are correctable with minor surgery, and I think it's also important to know that Parkinson's doesn't disqualify you from any eye treatments like cataract surgery or anything else. And if anything, I think that treatments to optimize your visual function are more important than ever, not just because of the ways in which Parkinson's can affect your vision, but then also because as mobility becomes limited, people will grow to rely even more on vision as their way of communicating and interacting with the world and things like that. So with that, I'll conclude. This is a picture of Pennsylvania Hospital, which is where our Movement Disorder Center is in Philadelphia, and I'm happy to take any questions.
What about when when there's dystonia and the eyes are closed? Is there anything that could be done to help with that?
That's a great question, Susan. So I think what you're talking about is something called blepharospasm, which is involuntary eyelid closure. And yes, that is a type of dystonia. So blepharospasm causes kind of repetitive blinking. So, we talked about how the blink rate is decreased in Parkinson's. This is kind of the opposite. It's kind of increased blinking, kind of this squinting or squeezing of the eyes closed. Many people with blepharospasm have sensitivity to light as well. And what to do about it depends on the situation in which it's encountered. So some people experience blepharospasm as a type of dyskinesia that happens when there's a little too much levodopa in their body, or maybe the levodopa is peaking a little bit, too much. And so that might respond to kind of adjusting the dose of medication or spreading it out a little bit more. Some people have blepharospasm when their medications wear off. So maybe that's something that needs to be adjusted as well. But when the medications are otherwise pretty well optimized, or maybe when symptoms are otherwise doing pretty well, except for blepharospasm, then one treatment for blepharospasm is actually Botox injections into the eyelids. And that kind of calms the eyelid muscles down so that they don't squeeze and blink as much. And that's something so blepharospasm can happen to people without Parkinson's too. It can happen to people with no other neurologic condition, and that's how we typically treat them.
Okay. Karen asked, are there some exercises you can suggest?
Unfortunately not. Like I was saying earlier, visual symptoms in general tend not to respond to exercise. But I think maybe kind of indirectly, the way to exercise is to just be active, whether that's reading, playing games, reading the newspaper, crossword puzzles, that sort of thing. Those are things that are good for your overall health, and that can also kind of contribute to better vision. So no specific exercises for visual symptoms, but I think it kind of depends on what's troubling you and that sort of thing.
And can you recommend any type of glasses? Because I have trouble with depth perception at night.
Depth perception is something that unfortunately glasses can't really address that well. If the difficulty with depth perception is related to double vision or misalignment of the eyes, then maybe that's something that prisms would help with. But one thing to keep in mind is that whenever someone's difficulty with vision is primarily at night, and I'm guessing, although I don't know, that maybe what this person's describing is difficulty driving at night and kind of telling how far away the car is at night. There could be other factors at play, such as cataracts or something like that too. But unless there's double vision or misalignment of the eyes, which can be corrected with prisms, depth perception is otherwise not something that responds to eyeglasses, unfortunately.
This is from Marlene. Gary has one eye that moves out when looking straight. He can voluntarily move the eye to focus. This movement out causes double vision.
Yes, that's the type of double that I was talking about earlier, where people see two of something instead of one. So what that's kind of referring to is a natural tendency of the eye to drift apart, or one eye to kind of turn out. That is something I should clarify that is not only related to Parkinson's. Like, there are people without Parkinson's who get that too, but we know that it's more common in Parkinson's, and we think the reason is that there are parts of the brain that are responsible for holding the eyes together and keeping them focused. and that those parts of the brain don't function as well, you know, in people with Parkinson's. So that's something that kind of when we talk about prisms or, you know, other type, you know, correction for double vision, that would be something to look into.
My husband saw a neurological ophthalmologist and his vision hadn't changed. When he went to get new glasses, the optometrist checked his eyes and also said that his prescription hadn't changed. However, he still cannot read well with glasses on.
You know, that could be a lot of things. It's a little hard to tell from just that one description. You know, like I was mentioning earlier, difficulty reading is common in Parkinson's, and I wonder if it might be related to that, you know, when I was talking about kind of moving your eyes from one word to the next. Slowness or difficulty can result in this feeling of difficulty reading, even with your glasses. One thing that would be important is to kind of clarify whether the glasses are bifocals or progressives, or whether they're dedicated reading glasses. If they're not, then you might want to give just dedicated reading glasses a try. And then also, a dry eye can contribute to difficulty reading as well. So if that's not something that's being addressed, that might be something to look into.
Thank you. Okay. My husband recently had cataract surgery, new glasses, and still has occasional double vision and dry eyes reading. And any suggestion for his upcoming eye exam?
Well, I think be important to clarify whether the double vision is the kind that gets better when one eye is covered, or the kind that goes away when you know, one eye is covered. Because I think that would be important to clarify whether this is something that's double vision related, where the prisms might help, or is this just about needing a new prescription or something like that. And then I'm not sure if this is tired eyes or kind of dry eyes, but that might be something to look into as well. So for the upcoming eye exam, what I would suggest is asking about ocular alignment, the kind of words that you should use, and seeing if that is something that prisms or some other type of intervention for double vision would help with.
And what an amazing presentation, Doctor. We can't thank you enough. So informative.
Thank you. It was
yeah,
good.
it was really, really great.